Let's talk about chronic gastritis as we discuss face breathing. Chronic gastritis refers to a host of chronic gastric mucosal inflammations stemming from various causes. A common disease, it has the highest incidence among various gastric diseases. Most patients are asymptomatic or experience varying degrees of indigestion, such as a dull pain in the upper abdomen, loss of appetite, abdominal fullness, or acid reflux. The main causes of chronic gastritis are long-term use of foods or drugs that are irritating to the gastric mucosa, excessive drinking, smoking, irregular eating habits, and intake of foods that are too cold or hot. When we do face reading, we look into the capillaries in the eyes, which are moving towards the iris, and several red patches on the palm surface, and shiny dots or patches with a red tinge in the stomach zone of the ears. Here is an illustration showing the capillaries in the eyes and shiny dots or patches in the ear. For the therapeutic method, patients with chronic gastritis should exercise frequently and give attention to their diet to avoid upsetting the stomach. As a dietary advice, the patient should consume a light diet, eat less fatty, sweet, greasy, spicy, and pungent foods. Drink less alcohol and less strong tea. Avoid consuming foods at extreme temperatures. Cold foods such as ice cream can irritate the stomach and aggravate the symptoms and are thus not recommended. As for exercise, the patient should not engage in vigorous activities immediately after a meal as it will cause indigestion. Rest for an hour after a meal before you exercise. For emotional adjustment, human emotions are closely related to secretion of gastric acid and digestion. So when your mood is low, even a delicious meal will taste as bland as wax. It is best to stay positive and relaxed at meal times. For medicinal diet therapy, we can use Codonopsis and red date tea. 15 gram of Codonopsis, 10 red dates, 3 gram of dried orange peel. Decoct these herbs to make a tea. Drink the tea twice a day for 7 days as one course of treatment. The tea can nourish the spleen, replenish the stomach, reduce inflammation, and effectively improve the symptoms of chronic gastritis. As for massage, we can massage the Susandi or stomach 36 point to replenish the spleen and stomach, regulate chi and blood, and improve deficiencies and weaknesses. This acupoint is mainly used to treat stomach diseases. We use our fingers to press knead the Susandi point or the stomach 36 point 50 times clockwise and 50 times counterclockwise 3 times a day until the skin feels distension. Thank you for listening.
Interviewing. Let's talk about menstruation. There are several areas of inquiry that can help to differentiate the diagnosis in women. The length, regularity, quality, and quantity of her menstrual bleeding, pain associated with the cycle, physical and emotional changes during the cycle, irregular bleeding during the cycle. Inquiry must also be made into a woman's gynecological history, the age she started to menstruate, whether there have been any births and pregnancies, and if so, how these were, whether there are any complications and problems, whether there were any symptoms that arose concurrently or immediately afterwards. Inquiry must also be made into the use of contraception. Many forms of birth control can cause imbalances in themselves. Furthermore, the use of the contraceptive pill or the coil will directly affect her menstrual cycle and bleeding, and this must be taken into account when considering her replies. If she is menopausal or postmenopausal, she should be questioned about when her menstruation ceased and whether there were any discomforts associated with it. Finally, inquiry should be made about discharge from the vagina. The information obtained about the menstrual cycle as well as the gynecological history in general will be relevant not only to the specific diagnosis of gynecological imbalances, but also to the diagnosis in general. It is said that women are more difficult to treat because there are so many changes in their physiology and in the balance of yin, yang, qi, and blood throughout the menstrual cycle. On the other hand, women are easier to diagnose precisely because of these fluctuations during the menstrual cycle, and the menstrual cycle and bleeding will act as a barometer for the whole body. Asking about the menarche, the first menstruation, can give some indication of the woman's fundamental constitution. If she has never had a menstrual bleeding, or if she had her first menstruation at a late age, it will be a sign of one or more imbalances. A girl should begin menstruating at the age of 13. A woman's Jing cycles are 7 years long. The first Jing cycle starts in utero, so a child is, in fact, 1 year old when born. The menstruation should start at the beginning of the third cycle, example, when she is 13. If menstruation does not start at around this age, it could indicate that she is Jing deficient or blood deficient. Example, there is a lack of substance to create bleeding. It can, though, also be a sign that there is a stagnation preventing the flow of the menstrual blood. Inquiry into pregnancies and births will give an idea of the state of her Jing. If there have been complications during pregnancies and births, this can indicate that there may be kidney deficiency, spleen deficiency, heat, qi stagnation, and so on. Repeated and frequent abortions, miscarriages, and births can weaken a woman's Jing and blood. On the other hand, a woman who easily becomes pregnant will have strong Jing and blood. If she has had difficulty becoming pregnant, it can indicate Jing deficiency, blood deficiency, dampness and phlegm stagnation, qi stagnation, heat, cold, kidney yang deficiency, or kidney yang deficiency. Infertility is due to the following: a lack of potential, Jing deficiency, a lack of activation of this potential, yang deficiency, or lack of nourishment to the fertilized egg or embryo, qi deficiency or blood deficiency, the nourishment being blocked by some form of stagnation, dampness, phlegm, qi stagnation, or blood stagnation, heat that agitates the egg so it does not unite with the sperm, or the fertilized egg does not settle and attach to the wall of the uterus. If the woman has miscarried several times, it can be a sign that there's kidney or spleen qi deficiency. But heat is also a possibility. A very rough rule of thumb is that if she miscarries in the first trimester, it can indicate kidney Jing deficiency. This will correspond to a genetic defect in the Western pathology. And if she repeatedly aborts in the final 2 trimesters, it is either kidney qi deficiency, which is the kidneys failing to control the opening and closing the lower orifices, or a spleen qi deficiency, where the spleen failing to hold things up and in place. Thank you for your attention. Let's talk about auricular acupuncture and its clinical applications. Treatment of pain. When needles are inserted in the appropriate corresponding somatic sites and left for 15 to 30 minutes, auricular acupuncture is very effective for the treatment of both acute pain. Example, decreasing post-operative pain after a tonsillectomy, and chronic pain such as migraine, cluster, and sinus headaches, trigeminal neuralgia, and lower back pain. Clinical findings suggest increased effectiveness for pain relief when combined with body acupuncture, particularly in treatment of chronic pain. However, there are some studies that have found no additional efficacy of pain relief when using the combination of auricular and body needle acupuncture. Auricular therapy has also long been used in pain clinics in conjunction with other Western treatments. Treatment of anxiety. As per clinical observation, auricular therapy has an increased relaxation effect on the patient in comparison with body therapy. It is not uncommon for individuals to report feeling drowsy after a treatment session. This effect has been useful for the treatment of anxiety, especially in a preoperative setting. Auricular acupuncture is also useful in patients who have a fear of needles, as the patients are not able to see the needles inserted in the ear. Now, treatment of hypertension. Although body acupuncture has been known to treat hypertension, there is presently no known study supporting the use of auricular therapy for hypertension. Treatment of post-operative nausea and vomiting, or PONV. Numerous studies have been performed documenting the use of body needle P6 for treatment of PONV. However, auricular acupuncture is not only effective for the treatment of PONV, but also patients are often more comfortable during auricular therapy and can use their hands freely during treatment. Detoxification for drug addiction. There are numerous reports that auricular therapy may assist in treatment for substance abuse of cocaine, particularly in combination with psychotherapy and group sessions. For the treatment of smoking cessation and alcohol dependency, results are still inconclusive. Now, treatment of insomnia. Auricular therapy has been found to be effective for treating insomnia. Treatment of gynecological problems. There have been several studies demonstrating the effectiveness of body acupuncture for dysmenorrhea, vaginitis, and others. Auricular acupuncture is effective for hot flashes. Selection points. Just as body acupuncture employs placement of multiple needles in specific combinations, auricular therapy often uses a combination of primary somatic points and secondary assistant points to treat pain or other problems. The primary somatic point is often selected on the ear, which corresponds to the organ or system of interest. Example, treatment of eye pain utilizes a specific somatic point related to the eye. Other assistant points are then chosen that may not relate to the area of pain but have been clinically proven effective in holistic therapy. Example, the so-called Shenmen point is known to be effective for sedation as well as pain relief. In the case of eye pain, a third assistant somatic point for the liver is often chosen due to the relationship between the two organs. Chinese medicine theory states that the eye is the window of the liver. So in conclusion, auricular therapy is a simple, economical, and effective method for the treatment of various ailments, but especially for pain management with minimal side effects. Thank you for your attention.
Okay, let's discuss differential diagnosis, Western and Chinese medicine, impotence and loss of libido. Stemming from endocrine disorders, letter A, diabetes with tiredness, excessive thirst, frequent urination, hunger, blurred vision, slow healing infections. Letter B, hormonal imbalances, insufficient testosterone or excess prolactin in blood. Number 2, stemming from cardiovascular disorders. Letter A, blood vessel conditions, that is blocked arteries with cramping pain in calf muscles, numbness or tingling in foot, absent or reduced arterial pulses in lower limbs. Letter B, hypertension, raised blood pressure with or without symptoms. Some drugs used to treat blood pressure. Number 3, stemming from neurological disorders like letter A, multiple sclerosis, relapsing and remitting illness with progressive paralysis, bladder disturbance, and visual disturbance as typical features. Letter B, after stroke with severe disruption of brain functions, especially movement, despite recovery, there may be considerable loss of confidence. Letter C, Parkinson's disease with impaired coordination, muscle rigidity, slump posture, tremor, shuffling walk, slow movements, loss of fine motor skills, decline in intellectual function. Number 4, stemming from prostate cancer with painful urination, urinary hesitancy, urinary dribbling, retention, painful ejaculation, lower back pain. Number 5, other causes include psychological and relationship problems, spinal cord injury, nicotine, alcohol, cocaine, prescription medication like the beta blockers, sleeping pills, and antidepressants. For the Chinese differentiation, impotence and loss of libido, we have to do diagnostic questioning according to first the organ interrelationship. Kidney and liver govern achieving erection, which is the kidney, sustaining erection, which is the liver. Liver channel passes through the genitals, kidney and heart, liver pericardium, fire governs psychological aspect. Number 2, type of erectile dysfunction, impotence with restlessness, thin wiry body, hot at night, thirst, red face, peeled tongue, impotence or inability to sustain erection with loss of libido, intolerance to cold, lethargy, pale swollen tongue, inability to sustain an erection with abnormal discharge from the penis, painful urination, tenderness in genitals, that is damp heat in lower burner, impotence from stress, frustrations, anger, resentment, that is stagnation of liver chi, from overwork, physical mental exhaustion, worry, irregular diet, excess raw sweet food, that is the spleen chi deficiency. For the etiology, emotional factors, stress, anxiety, fatigue, depression, negative feelings towards sexual partner, smoking, excessive consumption of alcohol or other drugs, lack of exercise, inadequate sleep, chronic illness, old age. Number 4, some patterns. For the excess, there is damp heat, blood and chi stagnation. For deficiency, liver, blood, and kidney yin deficiency, kidney yin jing deficiency, heart and kidney yin deficiency, kidney yang deficiency, heart, blood, and spleen chi deficiency. Thank you for your attention.
Relationships between Zhang and Fu viscera, heart and small intestine, and the lung and large intestine. The Zhang organs belong to yin and are of the interior. The Fu organs belong to yang and are of the exterior. Thus, the relationship between the Zhang organ and its corresponding Fu organ is a relationship between yin and yang, interior and exterior. The meridians link each Zhang organ with its corresponding Fu organ, forming dyads of interior-exterior. The members of each dyad act complementarily and cooperatively, but they also affect each other in pathology. Heart and small intestine. The heart meridian pertains to the heart and connects with the small intestine, while the small intestine meridian pertains to the small intestine and connects with the heart, thus uniting them in an interior-exterior dyad. Excessive fire of the heart can transmit by the meridians to the small intestine, causing fire in the small intestine. This may manifest as oliguria with dark or red urine and dysuria. Conversely, if heat in the small intestine is excessive, it can also be transmitted through the meridians to the heart and cause fire to flare up in the heart. This may manifest as agitation, a red tongue, and sores in the mouth. Lung and large intestine. Meridians link the lung and the large intestine in an interior-exterior dyad. The depuration function of the lung helps to enable the large intestine's function of transmission. And the normal functioning of the large intestine's transmission helps depuration by lung qi. If depuration by the lung fails, then fluids may not descend, leading to constipation. Conversely, if the large intestine's transmission fails, then the lung's depuration may be affected and lung qi may fail to descend, giving rise to tightness in the chest, coughing, and labored breathing. When treating diseases of the lung and the large intestine, the physician must bear in mind this relationship between them in order to enhance the therapeutic effect. So the following illustration will show us the exterior-interior relationship of the small intestine and the heart via the heart meridian of Han Shao Yin, and the heart to the small intestine via the small intestine meridian of Han Tai Yang. Likewise, with the large intestine and the lung, large intestine via the lung meridian of Han Tai Yin to the lung, and the lung via the large intestine meridian of Han Yang Ming. Thank you for your attention.
Let's now proceed to diagnosis according to Zhang Fu organ patterns with kidney yang deficiency. Kidney yang deficiency, in the same way that kidney yin deficiency is a deficiency of the deepest aspect of yin, kidney yang deficiency is a deficiency of the body's deepest yang aspect. The strength of kidney yang is inextricably related to the strength of Mingmen. When there is kidney yang deficiency, Mingmen will be weaker and thereby so will the production of yuan qi. This has implications for many of the body's physiological processes. Now let's go to its etiology. Kidney yang is weakened by food, beverages, and medications that are cold in their energy and temperature, congenital weakness, chronic disease, old age, exogenous cold, hard physical work, and overexertion, lifting heavy objects, standing for long periods of time, and too much sex. Kidney yang is also weakened by chronic yang deficiency conditions in other organs. For its symptoms and signs, there will be soreness, weakness, fatigue, or a sensation of cold in the lumbar region, a sore, weak, or cold knees. There will be an aversion to cold, cold limbs, frequent or urgent urination, copious amounts of pale-colored urine, nocturia or enuresis, edema, loose watery stools, mental and physical fatigue, indifference and lack of vitality, wearing warmer clothing than others, tinnitus, dizziness, spontaneous sweating, infertility, poor sperm motility, pale complexion, slow and languid body movements, poor posture, weak libido, shortness of breath, lack of thirst, desire for hot drinks and hot food, pale, swollen, and possibly wet tongue, a deep and weak pulse, and the pulse may be relatively weak in the chair positions. The key symptoms, sore or weak lumbar region, frequent urination or nocturia, aversion to cold, a pale tongue, and a deep pulse. For the treatment principle, we warm and tonify kidney yang, and we can use the acupuncture points bladder 23, do 4, ren 4, ren 6, kidney 3, and kidney 7. We use the tonifying needle technique, and moxa is also recommended. For further explanation on the choice of points, bladder 23, do 4, ren 6, kidney 3, and kidney 7, tonify and warm kidney yang. The patient should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature, especially in winter. In practice, this means avoiding fruit unless it is boiled or baked, salad, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing food, such as oven baked and grilled dishes, which are more warming than steam and cooked dishes. Hot spices such as chili are not necessarily salutary because they will cause the person to sweat and thereby lose heat. Tonifying a deficiency condition is something that takes time and cannot be forced. The use of spices in general is helpful, though, as they can activate yang. Spices that warm and tonify kidney yang are cinnamon, cloves, fennel, basil, sage, fenugreek, horseradish, rosemary, and black pepper. Foods that specifically tonify kidney yang are oysters, smoked fish, salmon, tuna, lobsters, trout, mussels, shrimp, lamb, venison, duck, roast pork, kidney, chestnut, walnuts, pistachio, black sesame seeds, quinoa, oats, buckwheat, millet, aduki beans, black beans, the poor lentils, raspberry, and cherry. Green tea is cooling, so black tea will be better. Otherwise, ginger tea, fennel tea, yogi tea, and jasmine tea will all be good. A person who is kidney yang deficient must ensure that they get enough exercise. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. They must, however, be careful that they do not train so intensely that they become fatigued or tired because this will further drain their yang. It is a good idea to start the day with physical activities that can activate and circulate qi. Keeping warm is important, especially in the lumbar region and the area below the navel. Wearing a belly warmer or a woolen stomach scarf around the midriff and lumbar can be recommended. Protecting this area from draft should be a priority. A ginger fruit bath is also beneficial, as is drinking ginger tea. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and yang in general. Besides above advice, men should limit how much sex they have, including masturbation, as kidney yang is expended upon ejaculation. Lifting heavy objects and standing weakens kidney yang and should be avoided as much as possible. Kidney yang deficiency can be caused by the following patterns of imbalance: spleen yang deficiency, kidney yang deficiency, damp, cold, and in turn, this pattern can result to the following patterns of imbalance: spleen yang deficiency, kidney yang deficiency, heart yang deficiency, kidney qi not grasping lung qi, kidney yang deficiency, overflowing water, damp, phlegm, cold, blood stagnation, qi deficiency, and blood deficiency. Thank you for your attention. Sorry. To summarize, kidney yang deficiency has its etiology in chronic illness, excessive sexual activity, exposure to cold after sex, retention of dampness from spleen deficiency, and old age. Its underlying or accompanying pathology are kidney yin deficiency, spleen qi deficiency, retention of dampness, and its signs and symptoms: lower backache, cold and weak knees, sensation of cold in the lower back, feeling of cold, weak legs, bright white complexion, tiredness, lassitude, abundant clear urination, nocturia, apathy, edema of the legs, infertility in women, loose stools, depression, impotence, premature ejaculation, low sperm count, thin sperm, and decreased libido. The pulse is deep and weak, and the tongue is pale and wet. For the treatment principle, we supplement and warm kidney yang. For the acupuncture treatment, we use bladder 23 to supplement the kidneys, Ren 4 to supplement kidney yin and essence, Ren 6 to foster the original qi and fortify yang, bladder 52 to supplement kidneys and essence, stomach 36 to foster the original qi, do 4 to supplement kidney yang, kidney 3 to supplement the kidney yin and essence, kidney 7 to supplement kidney yang, and the extra point Qigong to supplement kidney yang. We needle the following points with supplementation and moxa. For severe water swelling, spleen 9 and Ren 9. To supplement spleen, large intestine, we use bladder 20, spleen 6, bladder 25, and stomach 25. For heart and kidney deficiency, we use heart 7, bladder 15, and pericardium 6. Thank you for your attention.
Let's discuss mechanisms of pathological change, progression, and outcome of illness. In the course of the onset and development of illness, the rise and fall of evil qi and genuine qi are not fixed and unchanging, but dynamic. These changes not only determine the pathological changes of strength and deficiency, but also directly impact the progression and outcome of the illness. The following are the main patterns. Evil qi retreats as genuine qi prevails. In the course of illness, as genuine qi rises, it succeeds in overcoming evil qi. This is reflected by the convalescence and recovery and is perhaps the most common outcome. For example, an illness caused by external climatic evils, evil qi usually attacks through the skin and hair or by the mouth and nose. If the body's genuine qi is sufficiently full and its ability to repel pathogenic evil is sufficiently strong, then it not only can slow the progression of illness and limit the illness to the superficies, but also can expel the pathogenic evil. Once there is diaphoresis and release of the exterior, then evil qi is eliminated and defensive qi and nutritive qi again act in harmony and the illness resolves. Prevalence of evil qi damages genuine qi. This is the path of deterioration, even death. Such a progression reflects either severe deficiency of genuine qi or powering strength of evil qi, so that the body's capacity for resistance is progressively diminished and can no longer effectively contain evil qi or prevents its advance. The damage to the bodily functions becomes progressively more severe and the patient's condition deteriorates inexorably. This situation is known as deficiency resulting from strength. For example, in an exogenous heat illness, when yin collapse or yang collapse occurs, then clearly genuine qi is unable to defeat evil qi. This is the typical course of ascendant evil qi overcoming genuine qi. Next, deficient genuine qi unable to eliminate evil qi. If genuine qi is unable to expel evil qi, but is sufficiently strong to prevent its further advance, the illness evolves into a state of stalemate in which the evil qi persists in the body but is contained. A different state evolves if evil qi has been overcome, but genuine qi is so weakened that evil qi persists in a mutated form. In both cases, the illness has moved from being acute to being chronic or to a state of residual illness. Thank you for your attention.
We start with a new topic, enuresis and incontinence. Enuresis, also known as nocturnal enuresis, indicates an involuntary discharge of urine. That is, the person passes urine without realizing it. This usually happens at night to children while asleep. Enuresis must not be confused with nocturia, that is, having to get up frequently to urinate during the night. Incontinence means inability to control the voiding of urine. The urine is passed involuntarily. The person involved knows he or she is doing it, but cannot hold it back. There are four main types of urinary incontinence. First is stress incontinence. Urine leaks when coughing, sneezing, laughing, exercising, or lifting something heavy, which causes increased intra-abdominal pressure. Second is urge incontinence. The patient experiences a sudden intense urge to urinate followed by an involuntary, sometimes abundant, loss of urine. It may occur during the day and throughout the night. Third, overflow incontinence. Frequent or constant dribbling of urine is reported when pressure on the bladder increases. It may be due to bladder outlet obstruction, such as benign prostatic hyperplasia or an atonic bladder, in diabetes, stroke, or multiple sclerosis. Fourth is functional incontinence. Behavioral changes, physical or mental impairment are observed even if the urinary tract is functioning properly. A patient may experience more than one type of urinary incontinence, the so-called mixed incontinence. Problems of urinary incontinence can be associated with severe diseases such as bladder cancer and Parkinson's disease, in case of urge incontinence, or spinal cord injury and multiple sclerosis in case of overflow incontinence. Therefore, it is important to make a diagnosis from the perspective of Western medicine and determine the causes of incontinence to exclude any underlying disease. Prevalence of incontinence increases with age. Quite often, elderly patients tend not to report symptoms unless specifically questioned because they feel embarrassed and wrongly think incontinence is a normal part of the aging process. In mild cases, a slight incontinence is relatively common, and it is seen in urinary syndrome and interstitial cystitis. Now let's go to etiology. First is weak constitution. This is a cause of nocturnal enuresis in children. Constitutionally deficient kidneys are unable to control fluids and fail to provide qi to the bladder. This results in nocturnal enuresis. Shock. Prenatal or perinatal shock in children can be a cause of nocturnal enuresis. This can be observed in a bluish color on the child's forehead. The natural decline of qi occurring with aging may cause incontinence in old people. This is due to a decline not only of kidney qi, but also of lung and spleen qi. Excessive sexual activity in men weakens kidney yang and may lead to inability of the kidneys to control fluids and therefore to slight incontinence. The persistent strain caused by a chronic cough may lead to incontinence in a mechanical way from strain on the bladder and in an energetic way from deficient lung qi not controlling the bladder. The weakening of the kidney energy occurring in some women after childbirth may cause a slight incontinence. Thank you for your attention.